So today we are going to be doing a urine analysis. So when instructing your patient or athlete about the urine analysis, you're going to want to give them a few instructions. So first, you're going to want to have males wipe the head of the penis with a sterile wipe, or if you're dealing with a female, you're going to want to have them wipe between the labia from front to back with a sterile wipe. And then you're also going to want to have them perform a clean catch, which is then having them urinate into the toilet for just a small amount, and then placing the sterile cup into the stream, continuing to urinate, and then after about 1 to 2 ounces of urine goes into the sterile cup, they're going to remove it without stopping the flow and secure the cup tightly with the lid. Then they will be instructed to give the sterile cup of urinate to you, and then so before taking it, you're going to apply gloves, which I have already done. You're then going to want to make sure you have a flat, firm surface so there's no chance of spilling. You are also going to need test strips, chemically treated test strips, and then you're going to remove the lid. And if the cup is small or the strip doesn't fit, you can always use a like a little squeezy tube to get the urine out and squeeze it onto the strip. We're just going to dunk this in here for about 1 second and then pull it out and wipe it on the side and dab it with a paper towel or tissue, because the excess urine can cause the chemicals to mix, which affects the accuracy of the test. So we're just going to dip it in and take it out, wipe it on the side, and I actually have tissues here as well that we're just going to place the strip on so we're not contaminating any surfaces. So now I'm putting the lid tightly back on and just setting that aside. So after about 60 seconds, you can test it against the bottle. So except for the leukocytes, if you have a test strip that is testing for leukocytes, you're going to want to wait about 120 seconds. So normal pee, so you're going to want to have your athlete look at the color, and obviously you can see it in the cup, but so normal color was like pale yellow. If there's red or if it's darker, then there's probably blood or hemoglobin or other metabolic proteins, so that's like never normal unless it's a little bit of blood in a female's urine when she's on her menstrual cycle. And then any clouded urine is infection. It is also with a very strong odor, so that any abnormalities like that should be followed up by a physician. So it's about 60 seconds, and then you're just going to place the test strip against the bottle without touching it, because you don't want to contaminate that either, and just make sure that the colors are normal. And once you are done, you are going to take the test strip in the hand of your glove. You're going to take your gloves off and put them in a biohazard bag so there's no contamination. And then if you use a squeeze, then you can also put that in the biohazard bag. The urine, you will just unscrew the lid and flush it down the toilet, and then the cup will also go in the biohazard bag. Okay, thanks.